Hi, I'm Sherry Tomlinson with the QA and Compliance team. Thank you so much for joining us for today's Right Way Wednesday. I'm here today with some team members from Western Reserve Masonic community in Medina, Ohio, and they are one of the recipients of the Compliance Excellence Award for 2017. So congratulations to all of you. Today they're going to talk to you about interdisciplinary communication within the facility and how it helps everyone be on the same page when it comes to patient care and just how they interact with each of the different departments in their day-to-day operations. So I'll turn it over to the team.
Hi, I'm Missy. I'm the physical therapist here. At the time of new resident evaluation, the therapist does a 48-hour plan of care. That involves the evaluating therapist, the patient, and the nurse that is supervising at that time. We go through what we call therapy goals regarding what time and what expectations we want them up, the weight-bearing status, any precautions, and we discuss discharge planning with them and where they plan on returning to home. In our documentation, we usually document that where we put what we are expecting for the evaluation, that we did the 48-hour plan of care report, and that who was attending at that time.
Hi, I'm Twyla. I'm from physical therapy. I wanted to just talk about the transfer training that we do with each person when we have them up on the floor. We usually do a transfer training at 2:30, which would hit first shift and second shift, so we can get a lot of the staff there. We usually have them do a demonstration. They watch the demonstration of the transfer, and then we have them do it just so they know any cueing or any safety concerns that we would have or they would do that we can fine tune. We make sure that we use the best assistive device that they could use, whether a slide board or a mechanical lift, whatever they need to use for that transfer training. As the documentation, we just document that we did the transfer training with nursing staff and what is the device that they used.
Hello, I'm Brianne. I'm from Occupational Therapy, and one tool that I like to use with the nursing staff is our therapy screens, which include the quarterly screens and the fall screens. It really helps us get in terms with the nursing staff is experiencing with the resident, if they've had an overall functional decline, if the patient isn't able to tell you exactly what's going on. And it's also a good form of documentation for the nursing to use as well to communicate with us when they're experiencing declines, especially the falls, like what happened with their witness reports. And then we take it over to Sammy.
Hi, my name's Sammy. I'm the occupational therapist here at Western Reserve. I am going to talk about our Hey Therapy screens. Hey Therapy kind of creates an open dialogue between the therapist and the nursing staff. Nursing staff member fills out one of these Hey Therapy forms, which lets us know a functional deficit. With this, we encourage the nurse to document these deficits, so it is justification for us to pick them up for therapy. With the nursing documentation from the Hey Therapy forms, we're able to provide a nice, adequate reason for referral upon evaluation.
Hi, I'm Kaylee. I'm from speech therapy. I'm also the director of therapy here. Just wanted to touch base a little bit on some tips that we've found as a team to help just get that rapport with the staff, whether that be an STNA, a resident assistant, our administrator, our DON, housekeeping. Really what we've found that works well is just smiling, getting to know the employees, really knowing their names, really gaining that one-on-one rapport so that they feel comfortable coming to us and saying, this person's a more difficult transfer, or this person's having trouble with their assistive device or their feeding tools or whatnot. So really just one-on-one, getting to know their name, and really just taking the extra time and extra minute to go out of our way. So if you see that if someone's having difficulty, jumping in and seeing how you could help. It might not be the most productive thing at that time, but truly it's becoming, you're gaining your rapport, and it helps in the big picture. to make sure that our patients are getting what they need as we're working with them. Thank you so much for watching. These have been a few things that have been helpful for us, and we hope they're helpful for your teams as well.